Okay, welcome back. So now I want to talk to you about something that always comes to the table. People are always asking me this, and I really want to make sure that you understand the difference between the licenses that allow you to practice as the most responsible physician and the licenses that do not allow you to practice as the most responsible physician. Okay? There's a lot of confusion out there because people don't understand how some licenses might impact their ability to practice or the scope of practice. And also the name of the licenses are very confusing. So I want to organize all this. I'm going to start talking first about what's the difference of the most responsible physician to the non-most responsible physician. After we have that sorted out, I will then talk about the names of licenses that might be misleading and what they actually mean. Okay? So first, what is the most responsible physician? So this is in Canada very frequently referred to as MRP. So they will always mention who's the MRP, who is the MRP. So usually there is a person who is the most responsible physician taking care of a patient. So when a patient is admitted to a hospital, there must be a most responsible physician who's responsible for that patient. Some licenses allow you to be the most responsible physician. These licenses are called usually independent practice, okay? So back home, where you had your license to practice either as a general practitioner or as a specialist, if you were practicing without the need of having someone else approving your job or looking over what you were doing, you had an independent practice and you were the most responsible physician, okay? So these terms will be very important when I'm talking about licenses because I will be using them very frequently. So I need to make sure first that you understand what they mean, okay? Now, some of the licenses or roles that you will have here in Canada, even as a physician, might not be in the role of a most responsible physician. So, for example, if you practice as a clinical assistant in a province where they have licensed clinical assistants, you will not be the most responsible physician. So you will have a license, you must be a physician to be in that role, but you are not the most responsible physician, okay? Now, there is a bit of confusion when you start learning the name of the different licenses because sometimes the name is misleading. So I'll give you an example, okay? So there are many provinces that have what we call restricted licenses. Now, restricted licenses usually means they are still the most responsible physician. Now, the restriction might vary. It might be in the scope of practice. So, for example, you get a radiologist that can only work in breast imaging. That is a restriction on the scope of practice that would be expected of a radiologist. Sometimes the restriction is in location. So, for example, if a physician has an academic license, their restriction would be that they can only work in a hospital that is affiliated to the university where they have an appointment at an assistant professor ranking or higher. Okay, so they cannot go to a community hospital and they cannot simply change jobs because they have a restriction. They have a restricted license. They have a restriction on their license that is related to location. Okay, now, there are other restrictions, but when I hear a lot of people talking about restricted licenses, sometimes they think that the physician would not be the most responsible physician, and that is not true. Most of the restricted licenses allow the physician to practice as the most responsible physician and therefore counts as independent practice, okay? Now, if you are in a role where you're not the most responsible physician, such as the one that I mentioned, clinical assistant or associate physician, for example, that does not count as independent practice. And this will be important because when we're talking, for example, about clinical gap, usually the gap takes in consideration either formal postgraduate training or independent practice. So some of these roles or jobs, although they're clinical in nature, sometimes we even have a license, not necessarily will break a gap. So when I talk on the other section about gaps, we'll talk about this. But what I want to bring to your attention right now is that restriction or a restricted license does not mean the same as most responsible physician or not. And it does also not mean the same as independent practice or non-independent practice. Okay? So the first two things we clarified right now in this session is what's the difference between a most responsible physician and someone who is not the most responsible physician. We gave some examples of roles in those two situations. I also talked about the importance of understanding if your role is of independent practice or not independent practice. And I will also talk about how the name of the licenses can be misleading. So now I'll give you some examples of licenses that I will go in detail further in our future sessions, okay? But just so you get a little bit of an understanding, for example, in New Brunswick, we have a special license and we have a defined license, okay? The defined license in New Brunswick does not have the same meaning, the same rules, requirements, eligibility requirements, or restrictions as the license that has the same name in Nova Scotia. So in Nova Scotia, we also have defined license, like we have a defined license in New Brunswick, but in Nova Scotia, that is the entry-level license. Out of the restricted licenses, that is the one that is most limited in terms of scope of practice or location or restrictions. Now, in New Brunswick, the license that has most restrictions in terms of your ability to where you can work, the level of supervision, is the special license. So you can see that in New Brunswick, there's a special license, defined license, and then a full license. As in Nova Scotia, you start at the defined license, you go to a license called restricted license, and then you go to a full license. So the same name in different provinces can mean completely different things. And this makes the whole process extremely confusing. So don't feel that you are the only one that feel like you can't understand what's going on, and that you will commonly get confused with the license that you have in one province and the license that you have in another one, and you think they're the same, but they're not the same, okay? And we're gonna go over all that. Now, the terms that are most frequently used and that you need to get familiar with are full license and restricted license, okay? So full license means that you can practice to the full scope of the specialty that you applied for. If you're a family physician, that would be a full license in family medicine. If you're a specialist, it would be a full license in your specialty, okay? To get a full license, typically it is pretty much the same across the board. There is one pathway that applies to all the provinces, but after that, there are different pathways to get to a full license. And after the full licenses, there are many different types of restricted licenses, okay? Now, I want to go over the fact that when you have a full license, you are able to practice in that province to the full scope of the specialty that you are in, as I mentioned. And frequently, you are able to transfer that full license to a different province, okay? So that is one of the benefits of getting a full license. A restricted license not always is transferable. In some situations, you may be able to transfer from one province to another, okay? Now, I want to talk a little bit about the restrictions that you can have in your license so that you understand when I talk about restricted licenses, the things that you need to think about, okay? So I talked about a few of them. I talked about location. I talked about the scope of practice, but there are more, okay? Sometimes you need supervision. Now, here's another topic that frequently gets misunderstood. Supervision under a restricted license usually means that the person who has that license is still the MRP. So it still counts as independent practice. So for example, in New Brunswick, where we have the special license, that special license requires supervision. What does that mean? Is it a closed supervision like in a residency program or doing an internship? No, it's a different kind of supervision. Doing an internship or a residency, a fellowship, or any other training program, the MRP, the most responsible physician, is the staff physician that is supervising that trainee. It's a training position, okay? Now, when we're talking about restricted licenses that require supervision, we are talking in situations where the person who has that restricted license, they are the most responsible physician. However, there is a supervisor, which is usually a physician with a full license in the same jurisdiction, so in the same province, that will review that person's performance. That supervision is more of a distant supervision, usually involves review of charts, meetings that can happen weekly or monthly, filling out reports at the end of the month or sometimes at the end of the year. It's not the same level of supervision that would be expected of someone who is in the internship or in a residency program, where the supervision would be direct, or even if indirect, that person, that trainee, would be sharing with their supervisor their plan, their management, what they are hoping to achieve, what are their the diagnosis they think the patient has. They would be sharing all that information with that supervisor and seeking also input from them. And the final word in terms of that specific management for that patient would be that of the supervisor. When we're talking about the restricted license, the final word is still the MRP, is still the person who has the restricted license. But over time, there will be someone else making sure that that pattern, that performance of that person, that their ability to deliver care is consistent with what is expected in that jurisdiction. Okay, so if they start going off or away of what is expected, that supervisor has the power to communicate to the college that that person is not fit to practice medicine as an MRP, and that license can be taken away. So that is one of the situations that you can have, and that is why it's called restricted, but it is considered independent practice, okay? So again, I first needed to explain the difference between MRP and non-MRP, and then explain the difference to you about what is a full license versus restricted license, so that now you can understand when I talk about restricted license and supervision, that this kind of supervision under a restricted license has nothing to do with a supervision under a training position. And why is this so important? Because a lot of you come with training experiences or jobs from back home where you were supervised and you were in a training position, and you might think that you can consider that independent practice because you hear about people who have a restricted license here in Canada and are also supervised and count that as independent practice. But you cannot count anything that is training that was under closed supervision, that was under an educational program as independent practice. Now, if you had a license where you were making all your decisions, all the diagnosis, the management plan, the prescriptions, everything was done by yourself, and the supervision was at a higher level where your performance over time is assessed, like it would be, for example, at an employee at a company where their manager would eventually do an assessment of their performance, then that can be considered independent practice. Okay? So these are the main things that I wanted to go over on this session. I just want to make sure that I didn't forget anything, but I think that the most important thing here is for you guys to understand MRP versus non-MRP. What's the difference between full and restricted licenses? Understand that there can be many different types of restricted licenses, and that restricted license usually means MRP. I'm saying usually because there are exceptions. There may be a restricted license where the restriction is so tight that is not considered MRP anymore, but that is the exception. Usually restricted licenses are considered most responsible physicians with a high level distant supervision. And then we have the training positions that are not MRP and that are also restricted, but they're different kinds. Usually they're educational licenses or fellowship licenses or resident licenses, that the educational licenses, which usually encompasses, for example, resident trainees and fellow trainees. Okay, so with this in mind, I think you now have a much better understanding of the terms, and I will be able to use these terms throughout the course, and you will be able to follow what I'm explaining as we go along. So let's go to the next topic.